Mary Lee, we're here with you and Kelly to continue my education on these neuromodulators for the face, the Xeomin and Botox. So you already had the consult with Kelly, and now where are we?
Well, we're going to treat all three areas of Kelly's face today with Xeomin, which is the newest of the botulinum toxin type A's approved in the United States, been on the market about 4 years. She gets treatment for the lines across her forehead, and she's coming in today for her regular treatment, so obviously her lines are nice and smooth even today. So we're going to treat the forehead for the lines that go across the forehead here. We're going to treat the glabella area for the 11 lines that come here and the little line across the nose here. And then we're going to treat around the edge of her eye for the crow's feet that tend to show up with chronic squinting. And then we're going to put a little bit in her brow to give her just a little bit of a brow lift.
Are those smile lines as well? The squinting lines, are they smile lines as well?
Yeah, when she smiles real hard, you can see the muscle kind of contract around the edge of her eye here.
And those are predominantly common problem areas from most people's faces, right?
Yes, those are the three primary areas that most people do Botox treatments. So I'm just going to let you watch so you can see what the treatment looks like.
Great.
You can see that I'm not hurting her. We haven't used any numb cream, but I have cleaned her face real carefully with both a cleansing soap, surgical prep, and alcohol to make sure her skin's nice and clean.
Great.
And I'm going to take her back where I can get to her real good. Everybody's technique for doing Botox is a little different. I've always done it this way since I was trained by John Briggs at Fayetteville Plastic, and so this is the way I just always do it.
And that's been what?
10 years. So I started out by having Kelly squint for me a little bit, and like she's mad, which she can't do very well because I've kept her glabella nice and relaxed. But you can see a little bit of a pull there from her corrugators. Okay, you can relax. And you can just see we're going to take this little tiny 32 gauge needle, one little stick, no pressure. Good. First one's done. And then the second one, go right here.
It's kind of parallel on the other side?
Mm-hmm.
Okay. So
we're treating the muscles that are in that pull in on the brow to do that.
It relaxes them. Okay.
And then one right in the center here. And obviously you can tell, she feels it a little bit. It's a 32 gauge needle. It's very tiny.
Well, there's no skin there. It's got to feel a little bit.
There's not a lot of fat there.
Right.
So there's not a lot of cushion, and your face is very sensitive. So.
Right.
But it's
on a scale of 1 to 10.
What would you say?
A 3.
Really?
Maybe.
Okay.
2. I mean, you just feel it going in, but it's not bad at all.
Right.
Not like 11 or something like that.
Probably a 2 is more accurate.
We'd be able to tell.
Okay, so now we're going to have her raise her brows, which is going to show us the lines, the muscle movement in her forehead. So raise your brows up for me. There we go. You can see the folding that she's got going on here.
So that's the area you approach?
Well, yes. I mean, the forehead muscle goes all the way across the forehead.
I see.
And when you see people move their forehead, you can tell where most of their muscle movement is. And that gives you a good idea of where you need to relax.
Good.
So everybody's injection is going to be a little bit different.
Now that area is more like a 1. You barely feel it. That one's not sensitive at all, really.
Raise again for me. Good. Relax. You have to be a little bit careful when you're injecting the forehead because it is the only muscle that picks up the brow. So if you get it too relaxed, you create sort of a caveman look, which nobody really likes. But if you don't soften some of the lines out in the outer brow, especially for her, like when she raises her brow, do it again for me one more time. See how she gets these little parentheses that are way out here. So you have to relax those a little bit without getting too close to down on the brow.
Well, just like most of your procedures, there's the art and the science to it.
That's right. And some of it just takes years of doing it to see what it's going to look like. And also, I think every patient's reactions are a little bit different. All right, so let me just look at this one more time. Raise it one more time for me. Okay, just a little bit more right here. Have you ever had to come back for me to add any down here?
Mm-mm.
Okay. I think we're good then. Okay, I'm gonna switch my needle one more time. Just give me that. Is there an old cap? Yes.
And I've never had the caveman reaction either.
That's good.
So
Now your face looks good. Now, when you switch needles every
Pretty much
area
switch
that you
every
work on,
area. Yeah, and the reason I
Okay.
do that is the fresher the needle, the sharper it is, the less it hurts. And obviously that's the goal, is to make this the least painful as possible.
sure.
Okay, so I'm going to turn your head this way for me. And smile real hard. Let me find that muscle. You can see the edge of the muscle pulling up right there. Relax. So we're going to get just a couple little spots along the side here. You have to learn to sort of visualize where the muscle is, and that's where you want to put the Botox.
Right. Well, you've already got a little indication when she smiled, so you follow
Mhm.
the contours and then.
Mm-hmm. And again, everybody's anatomy is a little bit different.
Right. I think Kelly
Squint
smiles a
for me like
lot
the sun's in your eyes. Squint.
and easily, so you can find it.
This little injection in the arch
Uh-huh.
of her brow is going to give her just a little bit of a lift in the brow there, which most people really like.
Mm-hmm.
Do you notice a nice change when I do that for you?
yes, the brow.
Yeah.
Yes.
Smile again for me. And relax. Good. And you can tell that, this is not really bothering her a great deal. It's pretty easy. It's pretty quick. She's usually in and out of my office in less than 15 minutes. We'll stay out here on the edge so we don't get too close to anything that will bruise.
Yeah, it's pretty direct, but it's still involved.
Mhm.
Got to have somebody that knows what they're doing working on it.
Right.
It's good.
So that's pretty much it. I mean, that's how long it takes to do a full treatment.
When does she
She's-
expect to see results?
Full results are going to take about 10 or 12 days. I usually ask people to give it a full 14 days before we decide if they need any more treatment.
Don't forget that brow.
Oh.
I've been doing this.
Thank you. She has. Okay, squint for me one more time. Thank you.
Yeah, you got to get matching
You got me
arches.
nervous here on camera again. Okay, good job. Good job. Glad you're watching me. Keep
No,
me
that's
honest.
I've noticed the last couple of times we've done this, the rapport you have with their patients, they can tell you.
Yeah. Well, I think it's really important to involve them.
Right.
Make sure they know exactly what they're getting, why they're getting it, why it works, why we're putting it where we're putting it. Smarter patients just make better patients. They're easier to take care
Hey,
of.
that's great. Yeah, we'll use that as a tagline.
Okay. Thanks, Kelly.
You're welcome.
Yeah, thank you both for that. Very informative.